Hello, everyone, and welcome. Thank you all for joining us today for Understanding Indigenous Youth Journeys in the GTA Mental Health System, Insights from the Bridging the Gap study. My name is Lauren Harney, and I'm the research coordinator at Finding Our Power Together. I'm really grateful to have all of you joining us today and taking time to be a part of this conversation. We know everyone brings different experiences and perspectives into this space, and we appreciate you being here to learn, reflect, and engage alongside us. Today's session is an opportunity to learn together, reflect together, and think critically about how Indigenous youth experience and navigate mental health systems. And we're really glad that you're here. Just to give everyone a sense of today's flow, we started our time together with a welcome and a grounding to open our space today. From here, Dr. Nicole Anise Nash will begin by introducing Finding Our Power Together and sharing some context about the work that brings us together today. Following that, we'll move into an integrated presentation on the Bridging the Gap study, including context, methodology, and key findings. And then we'll hear a series of conference-style presentations from members of the research team offering different analytical lenses connected to this work. From there, we'll move into implementation and partnership opportunities before opening the space for discussion and Q&A. It's now my pleasure to introduce Dr. Nicole Anise Nash. Nicole is the Executive Director of Finding Our Power Together and leads this work grounded in Indigenous community-based approaches to research and systems change. Nicole, I'll pass it over to you.
Thanks, Lauren. I'll start by introducing myself and then talk a little bit about the work we're doing at Finding Our Power Together, as well as introduce the Bridging the Gap study, which we are very happy to be presenting about today in celebration of Mental Health Awareness Month. Nana bojo, wachi, zonje winishe, wabagwanin queen indishnikas, mamamatwa minua takarant and indonjaba, makwanidodam, anashname quinindao. As I was saying, my name's Nicole Anise Nash. I use she, her pronouns. I also carry the name Strong, Beautiful Wildflower Woman, and I'm Mishkigo Cree from the place where the three rivers meet, also known as Mamamatwa in Treaty 9 territory in Northern Ontario. But I currently reside and was born and raised here in Takaranto, where I live and work, and really pleased to be here to share some of the work that we've been doing in relation to Indigenous youth mental health. I am the founding executive director of Finding Our Power Together, and we are a national Indigenous-led nonprofit organization that is ultimately dedicated to ending preventable death by suicide in Indigenous communities and supporting the well-being of Indigenous children, youth, and communities across Canada. And we do this through offering a variety of culturally based and holistic programs, initiatives, and research. Our ultimate mission is to support our communities to not only survive, but to thrive. And we know that this takes not only interventions in the short term, but also an examination of the systems that create the unlivable conditions for our communities. And so we work towards this goal by offering both that immediate support through our programs and services, as well as looking at those underlying causes, doing systems analysis to really be able to identify what's at the root of all of these issues that we hear about within our programs, but also that the statistics tell us about. Just a bit of a highlight about what we do in a nutshell. As I said, we're ultimately really here to support our communities to thrive. And so we have a comprehensive suite of services that help to attend to the mental health and well-being of our community. We offer programs such as counseling services, peer mentorship services, psychoeducation programs, and traditional healing sessions. We understand that culture is a protective factor and really important intervention in thinking about suicide prevention. And so we offer a number of land-based, culturally based, and ceremonial services, including sweat lodge ceremonies, full moon ceremonies, fasting camp ceremonies, and land-based healing camps that really support our people to not only learn about mental health and to access support, but also to do so in ways that are culturally relevant and spiritually engaged. We have a number of youth and community programs where we offer supports to community members that maybe are less therapeutic in nature, but create community and create the conditions for people to be well, including things like youth leadership programs, our peer mentorship program, art-based workshops, community events and gatherings, and parenting programs and support groups. We also work directly with communities to provide them with the support that they might need that is specific to their community context, their cultural context, and the unique needs of their community, and work alongside communities to create custom in-community interventions, support in contexts of crisis, do community activation and engagements, and also support with various events. And of course, we do community-based research, which is what we are here to talk to you about today. We have a number of active research projects within our research lab, which is affiliated with Toronto Metropolitan University, where I additionally hold an academic appointment as an assistant professor and researcher. And we also do public education, advocacy, and training, things like we're doing today, to share our knowledge with other organizations, other systems actors, and ultimately to utilize research as a mechanism to support systems change. So today we're talking to you about the Bridging the Gaps study, and this is a project that we have been working on for the last 3 years that is really about understanding the mental health system in the Greater Toronto Area from the perspective of Indigenous youth. Our central research questions are to understand, what does the mental health system look like for Indigenous youth in the GTA? What strengths and gap exists in the current system? And in what ways can the mental health system be transformed to better support Indigenous youth well-being? Before I move forward, I also want to say that this project is a labor of love and a collaborative project that engages many different community members and organizations. It's been funded by the Ontario Trillium Foundation and is in partnership between Finding Our Power Together, the Centre for Grief and Healing, and Distress Centres of Greater Toronto. It is also informed and governed by our Indigenous Community Advisory Council, which is comprised of Indigenous community members from the GTA context, to ensure that our methods and our approaches are community aligned and ethically grounded. So our approach in this study, when we started, was the project entailed thinking about systems change and systems innovation. And when we started to work on the project, we wanted to think really critically and intentionally about how could we do systems change work? How were we able to do that in a way that is really driven by community? And so we took a phased approach, and we are currently entering into, well, we're midway through our third year of the project, of a 5-year long process to really first get to know the system, understanding what is available to Indigenous youth, what is out there, what is the landscape like, and what research already exists about this topic. Ultimately, to then hear youth stories and to hear community perspectives on what's working, what's not working, and what are the experiences within that system. We're also looking and studying how organizations work. And I'll tell you a little bit more about the methodology we're taking that helps us to do that. But it's one thing to think about what's on offer and what's available. It's another thing to consider how these systems, these structures, and these organizations are invariably embedded in colonial ideologies and biomedical frameworks that inevitably impact client care. And a key part to this work, and why we're really excited to be in conversation with you all today, is to think about new ideas and possibilities that might exist within the system. We have been learning quite a bit from the youth in our study, our Indigenous Community Advisory Committee, the partners that we are engaging with, and community members just like yourselves, to think about new ways of doing things. How can we bring forward different ways of approaching mental health in this context, and to ultimately look for solutions that really work for our community? Before we talk about the study, we wanted to share a little bit of context for why we think this work is necessary. Ultimately, we know that the mental health context facing Indigenous youth needs to be understood as a systemic and historically produced context. We hear many times the statistics about Indigenous young people, about Indigenous community members, and oftentimes those statistics are decontextualized from the colonial and systemic nature that has produced those outcomes. But it's still worth thinking through the need within our community, including that our community is facing some of the highest suicide rates globally. Suicide is one of the leading causes of death for First Nations youth aged 15 to 24, with rates 5 to 6 times the Canadian average and up to 11 times higher for Inuit youth. This is the core reason why finding our power together exists. We know that our people are dying by suicide at rates that are simply unacceptable. And we know that these are a result of the systemic, ongoing, persistent nature of a system that has sought to erase Indigenous people. We also know within our community that a significant proportion of Indigenous community members report a diagnosis of depression, anxiety, or other mental health concerns, which are much higher than rates of non-Indigenous peers. We also see that our community is not a homogeneous community. We have a community that has intersectional identities, including gender diversity, cultural diversity, ability diversity, as well as sexual orientation diversity. And so in our work, we've also seen that Two-Spirit and LGBTQ plus Indigenous youth report higher concerns in regards to their mental health and also think deeply about how to get support. We see that this is within the Indigenous population is reporting higher rates of suicide ideation as compared to the broader LGBTQ youth population. And we also see that our community is being institutionalized at much higher rates than non-Indigenous folks. In particular, we see that Indigenous children make 25% of those in foster care, yet represent only 3% of the childhood population. We also know that our communities are much more likely to be institutionalized in the justice system and be interacting with systems much more frequently than non-Indigenous community members. These figures, again, are not evidence of individual pathology or of lack that is residing within an individual, but rather they are evidence of a systemic system that is producing harm. And when we're thinking about supporting mental health and we're thinking about supporting the care of Indigenous youth, we need to begin from this understanding. There is, of course, a historical context for why these statistics are so prevalent within our community. And a full history lesson is beyond the scope of this conversation, but it is important to note that, you know, the visible crises that we see within our communities are oftentimes a result of, or at least being contributed to by these kind of historical factors, including the Indian Act, which continues to regulate Indigenous identity, particularly as it pertains to First Nations people. This is also the core policy that ensured that many of our people were allocated and ensured that they stayed on reserve properties. When we're talking about the Toronto context, while this is not a reserve context, we do have many community members who have membership to various First Nation communities, Inuit communities, and Métis communities. And oftentimes these experiences that they have within an urban context intersect with the policies that have been created to police and surveil and quantify Indigenous people. We also know that our community is very much still healing from the intergenerational and firsthand impacts of the Indian residential school system, which fundamentally sought to erase the Indian within the child and to assimilate Indigenous people into a Eurocentric society. Many of our community members who have had experiences within the IRS system have faced intense experiences of abuse, neglect, and harm. And within the context of Indigenous youth today, many of our young people are still facing the ramifications of those events, including being parented by those who were in residential schools, having experiences in day schools, or being forcibly relocated and thus having strained community relationships as a result. As was stated, many of our community members are also interacting with the child welfare system, and many of the young people in our study speak to those experiences and the traumas that occur through the removal of children from their families. This has resulted in many of our community members, whether they're aware of it or not, having experiences of intergenerational trauma, in which they are carrying the trauma of previous ancestors, previous generations, and are then trying to heal from their own lived realities in addition to breaking cycles that they inherited. Within this context, we also know that our communities are chronically underfunded, that there is systemic neglect of Indigenous communities, and oftentimes racist policies that contribute to a context where a personal journey is very much impacted by state policy. Within the GTA context, it's also interesting to consider the unique needs, perspectives, and experiences of Indigenous youth because oftentimes urban contexts such as the GTA are not considered to be Indigenous spaces. However, we know from our research that Toronto has one of the largest urban Indigenous populations, and that Indigenous children and youth make up a large proportion of that population. We also know that there's not good data about urban Indigenous youth experiences, particularly in the GTA. We don't have good census data. We don't have a lot of good data to be able to make funding decisions about our people, largely because official surveys generally undercount Indigenous people, and there are many reasons for that. Within the GTA context, we often see that there is a large number of services, and in my work working across the country, people talk a lot about the lack of services in remote and northern communities, and that is fundamentally true. But there is an assumption that we have a lot of services here in the GTA, when in fact we see that there are many barriers to accessing services, including limited culturally safe services, compounding social determinants of health as people navigate those services, as well as dislocation, alienation, and the mobility that exists within the GTA context. So it's within this context that we did our study, which was again to really understand this system from the perspective of Indigenous youth. We have a multi-method study where we talked to Indigenous youth using a semi-structured interview format that was premised upon an Indigenous institutional ethnography approach. We also then mapped their experiences of navigating the system, and you're going to see some of that in this presentation today. We also did quantitative data collection, talking to young people in terms of their service use, mapping frequency, distance, cost, various other factors, and including self-report scales to describe to what degree they were satisfied with their current service use. We talked to several key informants who work within the system to talk to them about how the system functions from their perspective, and then contextualize this information with a systematic literature review and landscape analysis to really understand this information. And then all data was analyzed through collaborative circles with our Indigenous Community Advisory Council, ensuring that analysis was grounded in Indigenous community realities. We interviewed 20 Indigenous youth from the Greater Toronto Area with distinct identities and backgrounds, including those of many different Indigenous nations, Afro-Indigenous, and other cultural intersections. And most of our youth were between the ages of 17 to 25, as well as having most of our participants identifying as women, but also gender diverse folks as well. So some of the key findings with our study are probably not surprising for those who work in the mental health system. The major finding was that the system is primarily non-Indigenous. Most of the services on offer, particularly that offer clinical therapeutic support, are non-Indigenous services. And most of them are geographically centralized in the city of Toronto, largely within the downtown core. This, of course, poses challenges for Indigenous youth who may live outside of that geographic encatchment or who are seeking Indigenous-led services or culturally based services. The second finding is that navigating the system is quite challenging for youth. While we might think that systems function very coherently, what our research reveals is that this is a very complex system, that there is not a coherent pathway for youth to follow, and thus navigating the system can be quite challenging, particularly if youth are in crisis, if they do not have support from family, or do not have access to some institutional knowledge that would help them to navigate this system. The system itself relies on referrals, and we can see that there are gate-kept services within the system that require diagnosis, that require referral, or that require particular eligibility criteria. And so for Indigenous youth in our study, they rely heavily on informal and community-based networks in order to navigate that system. We've heard a lot of young people talk about the role of family, the role of Indigenous community, and the role of having allies within their navigational journey. We also heard that the system requires youth to tell their story over and over again. They find this to be quite taxing and onerous, where they navigate each of these services and having to relive many of their traumas simply to get in the door. They talk about this as a re-traumatizing event and a labor that is required of them in order to access service. We also heard that the system is largely biomedical. The ideologies that are embedded within the system are very much crisis and cure based and do not account for the holistic well-being of Indigenous young people. There is little account of culture, spirituality, or holistic ways of approaching mental health. Many of the theories are based on a medical model that seeks to cure, medicate, and fix the individual. The system itself perpetuates experiences of discrimination and systemic harm. Participating in the system is not neutral. There are impacts of participating in the system, and oftentimes young people describe the trauma and the hardships that they encounter as they navigate the system. The system also positions crisis as a default entry point. There is a lack of preventative mental health care for Indigenous youth that is accessible, that is low barrier, and cost appropriate. Many young people talk about navigating the system and understanding that in order to get care quick, they need to be at a crisis point. We heard a lot about barriers and gaps in the system, and I'd be happy to talk more about these in the Q&A. But what we see is largely cultural incompatibility, lack of safe crisis care, oftentimes a misuse of medication. Youth are experiencing long wait lists, lack of follow-up, and oftentimes services that just simply do not come to fruition. That there is a lot of financial inaccessibility in engaging with clinical or what is described as higher tier mental health services. That the services that are on offer are fragmented and difficult to reach. That there are a lot of bureaucratic tools, rules, and eligibility criteria that create barriers for youth. And that stigma, fear, and mistrust of systems ultimately impacts whether or not a young person will seek care. In our approach to this data, we took an Indigenous institutional ethnography approach. And institutional ethnography, in simple terms, is really not about studying people as the problem, but rather looking at how institutions are set up, organized, understanding their rules, policies, and routines, and the impact that that has on service users. So in our study, we took this approach to really try to understand the system and the impacts that the system has on individuals who engage with it. And these are some themes from that analysis. The first is identity. Identity within this study is not necessarily simply about a checkbox, not simply about one aspect of identity, but we know that identity is a dynamic concept. It is something that is actively shaped by someone's experiences, by who they are, where they come from, and the experiences that they have. Within this context of this system, identity is often something that is reduced to a checkbox, but that is also something that is being actively shaped and resisted by Indigenous youth in this study. This quote on the screen says, "When I first heard about my diagnosis, I was like, this is just me. I was just excited to be able to put a name to it, to give language to it, and I can help myself further from this." Identity, therefore, speaks not only to an identity that someone has as an Indigenous young person, but also the identity that they are able to produce as someone with a diagnosis, a disability, with this experience of mental health or madness. And what we see in the system is that identity is often not actually included as any part of the care system. Culture was also a recurring theme. Oftentimes, we heard about the importance of culture from the perspective of Indigenous youth. We also heard about instances where culture was not respected, not included, and oftentimes having to choose between cultural services and therapeutic services, in which many clients wanted all of them, all of the above. In this quote, a participant shares, "I just don't feel the system respects Indigenous knowledge, values, or healing practices, because most of the time it just feels like those part of us are left at the door. What about ceremony? What about land, kinship, or storytelling?" And so culture is often excluded from mental health services, which are predominantly rooted in biomedical models. And this creates a disconnect where traditional practices are seen as separate from institutional treatments. It's also worth stating that institutions themselves hold a particular culture, one that again is prioritizing a medicalized system that really seeks to produce its own values and convey its own messages. Knowledge is a key theme within our study, and knowledge speaks to not just the information or the knowledge that participants hold, but also it's a ruling relation. In institutional ethnography, we're really interested in thinking about the power at play within the system. Knowledge is therefore important for how young people get access, whose voices are legitimized in that system, and who is excluded. This also speaks to the knowledge that institutions hold or gather about their clients and how they reproduce knowledge in such ways that prioritize institutional metrics versus the knowledge of participants themselves. One theme that came from this concept of knowledge was the institutional knowledge that is required to navigate this system well. As one young person shared, there are a lot of services. I think, though, they're kind of like hush hush. You have to know someone to know the spot, which I don't think it should be like that. Safety is another social relation that shows up within our data set, and it is produced through institutional text, professional practices, and everyday interactions. Indigenous youth are actively seeking, creating, and defending their own safety, often in contexts where institutional definitions conflict with their lived realities. They also speak to the double-edged sword of safety, where safety is often used as a regulatory framework to police and surveil their behavior. As one young person shared, I think at the end of the day, right now, in certain aspects, it's not the safest system for Indigenous youth. Indigenous youth are turned away, they're discriminated against, and if they don't feel safe accessing those kind of spaces, then that's kind of useless. Creating safe spaces is therefore a very important consideration that stems from this data. Because we were talking to young people about story, we were fundamentally interested in how story shows up. How do their stories tell us about the system? And also, what stories do the institutions themselves have to say? For Indigenous youth, storytelling is a vital cultural practice. However, within institutional settings, it becomes a demanding process of repeated disclosures through various intakes and assessments. And this constant retelling often re-traumatizes youth, as their complex lives are often reduced to standardized records, and their narratives are reauthored to fit institutional frameworks. As one youth shared, I've had 4 or 5 different workers, and I have to explain my whole life story to them over and over and over again. What we also saw within our data was that participating in this system is not neutral, as I've said. Interacting with systems fundamentally shapes the story. It shapes how Indigenous youth see themselves. It shapes the access that they have to care, to community, to other resources, and fundamentally shapes the choices that they make as a result. Interestingly, in our study, many of the participants talked about pursuing careers in the mental health space as a result of their story. And we can see that these stories fundamentally impact the trajectory of the story as it unfolds. Our study is very concerned with the navigation and the pathways that young people take to access care. Mental health pathways for Indigenous youth are often fragmented and gatekept by bureaucratic rules, and access is contingent upon correct diagnoses or referrals, which makes crisis the fastest route to care. This forces youth to navigate a complex system, often relying on informal, what we call pseudo systems, family and community to bridge institutional gaps. One young person shared, if you're trying to get a therapist or a counselor or someone to talk to, it's going to take forever. But if you're going into a hospital because you wanted to harm yourself, you're going to get admitted. And so we see a very sophisticated understanding of how to navigate this system, sometimes to exploit the system's rules and pathways in order to receive the care that they feel they deserve. And our last theme within this institutional analysis section, excuse me, is about work. And within an institutional ethnography context, Work really is about the hidden labor that institutional actors or clients need to take in order to make the system function. Oftentimes, we see these organizational maps or systems maps where things look like they are very coherent. You go here to get here to get here. But what we have seen is that those institutions serve institutional needs, and the clients do a lot of labor to try to move between these institutional actors. Therefore, Indigenous youth must undertake and make mental health institutions function for them. This extends beyond formal tasks and encompasses emotional and logistical burdens of navigating the fragmented system. As one young person shared, I feel like there's a lack of follow-up and resources. I was like, well, what do I do now? I'm left to pick up all the pieces by myself. The second that someone gets discharged from a service where there's no longer follow-up or there's no longer a referral pathway, we find that Indigenous youth must start over again. They must create the system to work for them again. And this constant restarting and stopping and restarting and stopping can be very challenging for young people, particularly those who are navigating intense mental health crises or have mental health concerns that require immediate treatment. And that's all for this section. I'm going to share a bit more about some of the strengths and visions that we heard from the study, but I'll pass it back to Lauren at this point to move us along in the agenda.
Thank you, Nicole, for grounding us and sharing the context, methods, and some of the findings from the Bridging the Gap study so far. We'll now move into a series of conference-style presentations from members of the team offering different analytical lenses and focused explorations connected to this work. To begin, we'll hear from Keelan, who will share an analytical exploration of journey mapping as a method for understanding service pathways and Indigenous youth experiences navigating systems. Keelan, I will pass it over to you.
Thank you. My name is Keelan. I am Red River Métis from Treaty 1 territory and a citizen of the Manitoba Métis Federation. And then along that lineage, I have a mix of ancestry, including Cree, Lakota, Polish, Icelandic, a whole mix. I did my Bachelor of Health Sciences in Pharmacology and Toxicology at Queen's, and I'm an incoming Doctor of Medicine student at University of Toronto, where I really hope to continue doing this type of work, especially within like the urban Indigenous community. So I'm going to focus on one of our main methods of this BTG study. So as it was explained earlier, we're looking at how Indigenous youth in the GTA are experiencing and navigating the mental health system. So we did an institutional ethnography approach along with story mapping, which you can see an example of in the middle of the poster. And this was to understand how those systems, policies, and that everyday practice shape these youth experiences and care. And our main goal here was not to only hear what youth went through, but to understand why these experiences are continuing to happen. So institutional ethnography and story mapping kind of go together. So institutional ethnography, it's the approach that starts with the everyday experiences, and then we're looking outward to understand how these experiences are shaped by that larger system. So when I say institutional, it doesn't mean just one organization or one building. It refers to larger ruling relations that coordinate these people's actions across all the different systems. So this can include what was discussed before, such as forms, policies, procedures, eligibility criteria, and these documentation processes. And then story mapping we used within this. So along the 20 youth interviews we did, we wanted to visually show their journey through the mental health system, including where they access support, where they might have encountered barriers, and then where these formal systems broke down. So a regular semi-structured interview could have told us what happened within this youth journey, but the story map really showed their movement through the system and that pathway visible. So for this specific project, the story mapping showed us that youth were not moving through one clear mental health pathway. Instead, they were moving through a mix of hospitals, schools, crisis services, community organizations, online supports, and then Indigenous-led programming. So the reason why we chose to do this method is we weren't only trying to document what the experiences were, but why they're continuing to happen. Youth were describing the system to us as confusing, unsafe, and expensive, as well as culturally disconnected. And then this mapping and institutional ethnography came in to help show that this is not just the outcome of one bad service or one bad provider. It's a structural issue where youth are navigating an entire system that's shaped by these disconnected services, these unclear pathways, and these barriers. So if you look in the middle at this map, I know it can look a little bit complicated. This was a map that was made after we talked to a youth about their path through the system and their timeline. So in blue, these are all the different institutions that this youth moved through. In yellow, this is all the different providers they were passed between. And in purple, those are the major life events that happened during this timeline. So we can see that this youth entered the system through hospitals, emergency departments, group homes, and they did not have early community support in this process. And then one of the first things I noticed is the amount of yellow circles, which show how many handoffs happened between different providers. And no single person actually stayed with this youth throughout their full pathway. They moved between psychiatrists, therapists, and school staff. And then they also had support that was interrupted by wait lists and changes in their physical location. And then something else that was interesting is advocates like this youth Nana, their grad coach, and Indigenous staff were really essential. They were key in helping this youth navigate the system when the system itself was difficult to move through. And then I noticed that Indigenous organizational supports also appeared later on in this timeline, so after multiple mainstream institutions came in. And this really suggests that the culturally relevant care was not happening in these places. So the main takeaway of the story map is it's showing that the care is not experienced as one clear pathway. You can see it's like a web of experiences. It's almost like a maze of referrals, different assessments, discharges, delays, and services. And a lot of the time, the healing depends on whether the youth has someone advocating for them. So the findings from this are very similar to what Nikki has just discussed in the slides prior, so I will just summarize. I think the main findings from this story mapping was that the GTA mental health system might look very broad and comprehensive on paper, but when you talk to youth and you map out their story, they're not experiencing it as a clear, coordinated pathway. Indigenous youth, they're systems navigators. They're not avoidant of the system. It's very clear by this map. They're trying to find care, but when these formal systems fail, they often have to build their own support networks from the ground up through family, peers, or personal knowledge, which not everyone has. And then many times, as mentioned, they have to detach their Indigenous identity to get care in these mainstream systems, and then have to choose between either choosing a Western approach or an Indigenous approach. A lot of the times as well, the system is prioritizing paperwork and over relationships. This youth described having to repeat those stories, completing multiple intakes, multiple physical testing just to get care for their mental health and therapy. A lot of the time, there's files, forms, risk categories, and then building a relationship with trust is really something that comes last or not at all. And this really aligns with that theme of work and this work that you need to do just to get through and into the system. And then third, the access depends so much on how you know the system and how it works. So youth with family or community members who understood these forms, these pathways had a big advantage. And then youth without that knowledge were very likely to be left out. And so in this case, that knowledge piece is dictating who is gaining access. And then finally, these findings show that the solution is not just adding more services. It's clear this youth had different services to access in their pathway. It's the system itself that needs a change. Youth are asking for Indigenous-led mental health care, free and low barrier access, and consistent workers. As you can see in this map again, the number of yellow circles shows how many people this youth had to jump to and from to find someone who was there for them and who they could trust and lean on in this process. So it's important to have those navigators and caseworkers that are really there for them, as well as that land-based and ceremonial healing. And then having Indigenous knowledge built into policy and practice rather than an afterthought or something that this youth has to seek so hard for. So overall, the institutional ethnography and the story mapping really helped shift our focus from the individual youth experiences to what systems and institutions were really shaping these experiences. And that really allowed us to look at these roles, the funding models, and the assumptions that are shaping care of Indigenous youth in the area. And then story mapping helped make these youth journeys visible to us. And it's clear that navigation is difficult just from looking at this example. So these methods overall really help show that Indigenous youth are not failing to access the system. The system is failing to meet their needs in a way that's coordinated, relational, and safe. And it's really important that we think about improving services and Indigenous knowledge bases in the system so that people feel safe accessing it, and that a story map in the future doesn't look like such a complicated web, and it's more clear for youth to get the care and help that they need. Thank you.
Thank you, Keelan, for helping us think more deeply about journey mapping and the ways pathways through systems can be understood and examined. Next, we'll hear from Rochelle, who will guide us through an analysis focused on youth experiences of suicidality and systems response.
Thanks,
I'll pass
Lauren.
it over to you.
Hi, everyone. My name is Rochelle Silve. I'm Anishinaabe from Chippewa-Zaburma First Nation. I'm a registered social worker, an MSW student in the Indigenous Trauma and Resiliency program at the University of Toronto, and a student researcher at Finding Our Power Together. My work focuses on Indigenous child and youth mental health, suicidality, relational healing, and culturally grounded approaches to care. The title of my paper is Distress Does Not Emerge in Isolation, Indigenous Youth Experiences Institutional Responses to Suicidality Within Western Mental Health Systems. The study examines how Indigenous youth describe experiences of suicidality within Western mental health systems, with particular attention to how institutional responses shape distress, relational safety, and experiences of care. Indigenous youth in Canada continue to experience disproportionately high rates of suicidality and mental distress. Existing scholarship has increasingly emphasized that Indigenous youth suicidality cannot be understood solely through individualized or biomedical frameworks. Researchers such as Chandler and Ladon emphasize the importance of cultural continuity and community connection in supporting Indigenous well-being, while scholarships and scholars such as Anslow and Kermiker critique the fragmented and crisis-oriented Western mental health systems that often overlook the broader colonial, relational, cultural, and structural contexts of distress. Despite increasing attention to Indigenous youth mental health, there's still limited research that has centered Indigenous youth's own experiences of suicidality within Western mental health systems and the impact institutional responses have on care, support, and that relational safety. So my research question asks, how do Indigenous youth describe their experiences of suicidality within Western mental health systems? And what do these experiences reveal about the influence of institutional responses on distress, relational safety, and care? And within my analysis, it specifically asks how institutional responses shape experiences of distress and support, how fragmentation, cultural unsafety, and crisis-oriented intervention influence care, and what youth narratives reveal about the need for more relational, cultural, grounded, and life-promoting systems of care. So the purpose of this study is to better understand how Indigenous youth experience institutional responses to suicidality and distress, and what these experiences reveal about the need to move beyond that crisis-oriented and re-traumatization systems towards a more relational and life-promoting approaches to care. The study draws on interview transcripts through the Bridging Our Gaps project, which is a community-led research initiative examining Indigenous youth mental health systems, and Nikki spoke about it before. I conducted a critical relational thematic analysis focused on experiences of suicidality, institutional responses, fragmentation, re-traumatization, and relational disconnection. The analysis was guided by a critical relational framework, which means the study examined how systems, relationships, and the institutional practices, as well as cultural safety, shaped youth experiences of that distress and care. Rather than locating suicidality solely within the individual, the analysis explored how distress emerged within broader experiences of fragmentation, unmet needs, relational disconnection, and also institutional responses. One of the strongest findings was that the Indigenous youth frequently described institutional responses to suicidality as fragmented, difficult to navigate, and also lacking relational connection. So youth described being moved between services, repeating traumatic experiences multiple times, barriers to meaningful support, and systems that often responded only once distress escalated to crisis for them. Participants also described experiences of cultural unsafety, dismissal, and relational disconnection within mental health systems. Importantly, youth narratives, they suggested that institutional responses to suicidality sometimes intensified distress, and it contributed to re-traumatization through fragmentation, through the crisis-focused intervention, and also that lack of relational continuity. At the same time, participants, they also consistently emphasize the importance of belonging, of cultural understanding, community connection, also relational safety and meaningful support. So process of cultural reconnection, kinship, and community reconnection, it really emerged as important forms of life promotion and collective well-being. Another really important finding was that youth narratives suggested life promotion cannot exist without access to basic human needs, meaningful mental health support, and relational care before distress escalates to crisis. One thing that complicated this study is that the original data set was not specifically designed around suicidality. So the interviews came from a broader study examining Indigenous youth mental health systems. However, the suicidality, it repeatedly emerged throughout participant narratives, which itself suggests the significance of these experiences within Indigenous youth's interaction with the Western systems of care. Because this was a secondary qualitative analysis, there were also limitations in terms of follow-up clarification or asking additional questions directly related to suicidality. The findings also complicated dominant understandings of suicidality as solely an individual crisis. Instead, youth frequently described distress within broader experiences of the fragmentation, unmet needs, cultural disruptions, relational disconnections, and systemic barriers. Another important discussion point is that dominant institution responses often remain heavily focused on crisis intervention and biomedical stabilization. While crisis intervention is very important, youth narratives suggested that crisis-oriented systems alone are insufficient and can sometimes intensify that distress or re-traumatization when relational safety, belonging, and meaningful support are absent. And this shifts the conversation from simply preventing suicide towards supporting lives that feel connected, safe, meaningful, and supported before crisis occurs. Overall, the findings highlight importance of moving beyond that crisis-oriented and biomedical models of intervention and towards the relational, culturally grounded, and life-promoting systems of care. One of the strongest implications from the study is that Indigenous youth frequently described systems that responded once distress escalated to crisis, rather than systems that supported connection, belonging, and relational safety, and that well-being before the crisis occurred. The recommendations on this board, they reflect this shift. So first, the findings suggest the importance of moving beyond risk management approaches towards life-promoting care. Youth narratives emphasize that preventing suicide cannot be separate from supporting lives that feel connected, feel meaningful, and supported. The findings also highlight the importance of prioritizing belonging, relational safety, and that continuing of care. Fragmentation and repeated crisis-focused interventions, they often disrupted the trust that was built, the connection, and that relational support that is being needed. Another really important recommendation is expanding access to culturally grounded and community-led supports before distress escalates to crisis. So participants continuously emphasize that importance of that cultural connection and really having that kinship and community in experiences of healing and well-being. The study also suggests that mental health care cannot be separated from broader social and structural conditions. Youth narratives within the study emphasize the importance of addressing basic human rights needs, the cultural connection, and collective well-being as a part of meaningful mental health support. And finally, the findings highlight the importance of improving cultural safety access across hospitals, schools, community services, and crisis systems, while also centering youth voices within that design, implementation, and evaluation of mental health systems and services. Ultimately, the study suggests that Indigenous youth suicidality cannot be separated from the broader experiences of institutional response relational safety, and systemic conditions of care. Thank you.
Thank you so much, Rochelle. Next, we'll hear from Joshua, who will share work focused on Afro-Indigenous perspectives and intersectional experiences navigating systems. Pass it over to you, Josh.
Thank you, Lauren. So the title of this poster presentation is Rooted Between Worlds, Afro-Indigenous Youth Storing Identity, Visibility, and Mental Health Access. A little bit about my story. As an MSW student since January 25, coming to Finding Our Power from York University, I've spent the past few months listening to youth stories during the programming, reviewing systems data, and examining how Indigenous and Afro-Indigenous youth navigate mental health services in the Greater Toronto Area. Through this work, I became increasingly aware that Afro-Indigenous youth often remain invisible within research production and service systems. While mental health conversations increasingly address Black youth and Indigenous youth separately, Afro-Indigenous youth are rarely centered in discussions about care, identity, or system navigation. This project asks how Afro-Indigenous youth experience these systems while navigating identities that are often misunderstood, simplified, or institutionally erased. The literature review conducted for this study situates Afro-Indigenous identity as not a simple racial category, but a relational and political experience shaped through kinship, movement, resistance, and survival. Together, this research suggests that Afro-Indigenous youth are not passive recipients of mental health services, but they're actively authoring identity and creating pathways of healing through storytelling, kinship, relational care, and resistance within systems that often fail to recognize the fullness of who they are. This project is a secondary qualitative analysis of the Bridging the Gap data and reports through an Afro-Indigenous analytical lens, while the original Bridging the Gap project centered on Indigenous youth experiences navigating the GTA mental health system. This analysis focuses specifically on 4 interviews with Afro-Indigenous youth to examine how identity is authored, negotiated, fragmented, and reclaimed within institutional mental health systems. The secondary analysis recognizes that Afro-Indigenous youth may encounter unique forms of invisibility within systems that often separate Blackness and indigeneity into distinct institutional categories. So the objective of this study is to examine how the Afro-Indigenous youth identity, visibility, and mental health access, how they access within institutional systems. The research questions are, how do Afro-Indigenous youth navigate identity, belonging, and visibility within mental health service encounters, as well as how do institutional systems shape access to care, relational support, and experiences of rupture or recognition. The primary methodology for this project is a braided analytical approach, as I said, which integrates Indigenous relationality, institutional ethnography perspectives, Afro-Indigenous futurity, Ubuntu, which is I am because you are, and within Swahili, it is Mtu ni Utu, a person is a person through other people, which is a African philosophical value system that is seen throughout the continent of Africa, as well as integrating into the braided approach decolonial systems critiques, but in particular from Frantz Fanon and contemporary writers like Dr. Lewis Gordon. So some of the findings that we found so far in preliminary stage are identity negotiation, in that youth navigate systems that treat identity as fixed, singular, or administrative knowable. Institutional fragmentations, services were difficult to navigate across disconnected programs, referrals, and eligibility pathways. Labor of belonging, youth carried the work of explaining who they are, why they belong, and what support they needed. Relational healing, recognition of cultural safety, kinship, and trusted relationships shaped by meaningful support. And the futurity, youth imagine systems beyond categorization, grounded in relational accountability and self-determining identities. And throughout all of these findings, we see that immigration and travel are a large part of Afro-Indigenous youth experiences, whether that is in their journey as their person or their family's journeys either to Canada or around Canada as well. And so I took a specific acknowledgement as well of these identities at play and how they're coming into these urban spaces. And so within our discussions and implications, the systems often regulate youth through fixed categories of identity, eligibility, and risk. Afro-Indigenous youth perform identity work while navigating care, and system change is requires relational, culturally grounded, and community accountable care. The recommendations moving forward for this study is to center Afro-Indigenous youth voices in mental health designs at all stages, to build intake and referral processes that recognize the complexity and relational identities, and to train intake workers, especially on the complexities of Afro-Indigenous identity, to reduce institutional pressures, to improve, explain, or simplify identity, as well as strengthening cultural identity grounded relational and community-led supports. And finally, to treat Afro-Indigenous youth as knowledgeable holders and authors of system change. Thank you very much. I'll pass it back to you, Lauren.
Thank you so much, Josh. And to help bring these different perspectives back together, I'd like to invite Nicole back to reflect across some of today's themes and key learnings.
Thanks, Lauren, and thanks to all of the presenters for sharing their unique perspectives. As you can see, the Bridging the Gap study has so much meaningful insight into how we can think about redesigning this system. We're not only interested in thinking about the gaps and thinking about the problems, but also to think about what can we learn from what's working well, and what do youth envision for a mental health system that would, in fact, actually meet their needs. And so throughout the project, we also asked our participants about what works well and some of the strengths and promising practices we want to share with you here today. One of the key findings here in terms of what works well is when there are Indigenous-led models of care. And why these models seem to work is that they take a more holistic approach to supporting an individual. As we've seen from the different perspectives shared here today, that we have very complex people. People's lives are complex, our identities are complex, and our needs are complex. And what we heard time and time again is that many services that are on offer are very prescriptive in terms of supporting only one aspect of an individual's well-being, while oftentimes neglecting others. This is a problem when we think about a social determinants of health model or a wellness model, where we might need to attend to different aspects of someone's life in order for them to have the conditions to be well. We heard that Indigenous services, community networks, and support systems often do take that more holistic approach, where not only are they attending to someone's mental health, but they're also attending to their spiritual health and well-being, their physical health and well-being. We heard a lot about food as being medicine and the importance of having nutrition and access to food security as being really integral to mental health care, as well as having access to the other sort of social determinants of health, including housing, financial security, education, etc. Alongside this, we heard that access to land and ceremony helps improve healing outcomes. And we saw some quotes on some of the slides about the importance of being able to access traditional knowledge and healing, ceremony, land, traditional medicine, traditional approaches, and to be able to heal in the context of healing with creation. We've heard so many times the importance of having access to this as being really life-changing and life-saving approaches to someone's mental health journey. At the same time, we heard that Indigenous services and programs are often insufficient as they stand currently, mostly because most of those services do not offer or do not have capacity to offer clinical mental health services. Things like being able to see a psychiatrist for medication, assessment, or diagnosis, or to be able to access more intensive mental health care, including things like dialectic behavioral therapy, CBT, and EMDR, things that would be really important and integral to supporting and treating someone's mental health condition. And so a promising practice that emerged from the research was really about services that are able to connect two of them together. Cultural and clinical integration helps to improve treatment outcomes, particularly in cases where they are treated as having the same reverence. Sometimes we've heard of services that have Indigenous culture as an add-on, and the problem with that is that there's always a hierarchy within those contexts. Having a meaningful braided approach where we have cultural and clinical integration meaningfully allows for participants to have choice, to have different types of pathways in their health, in their healing journey, and ultimately keeps them in care longer and improves the outcomes they have within those systems. We heard a lot about the importance of relationships in all of the presentations today, and relationships certainly are very important to the experience that participants have within the system. We ask sometimes about how important is it to have Indigenous practitioners within this system. And while many said that they agree that that should be a goal, that being an Indigenous practitioner was not necessary. Rather, that we need culturally competent practitioners, culturally safe practitioners, whether they are Indigenous or not, who can help build trust, meaningful relationships, and to understand young people's perspective across various domains. The relationship being central to the intervention, the trust that gets built over time, and having a long-standing relationship with someone who is culturally safe and culturally competent and who genuinely cares about the young person. We also heard about a need to think deeply about access into this system and having flexibility within services to reduce some of the access barriers. Oftentimes, there are institutional constraints on whether a young person can access a service, again, including eligibility criteria, particular pragmatic approaches, such as a weekly recurring in-person session, might be challenging for folks who have other responsibilities, including taking care of their own children or other family members, or who do not have access to a vehicle or transportation. And so we heard a lot about thinking more creatively about services, having flexible type services, having choice as being a central part of this pathway navigation. And we heard that this flexibility can show up in sometimes unexpected places. One of the places that we heard this show up quite frequently is in post-secondary education systems, where many young people were able to access care in ways that were more flexible, were promoted their self-agency and autonomy more frequently, and allowed them to build the support network that they fundamentally wanted. We also heard the importance of peer and community support, and that peers and community and friendships and family are very integral to this system. And rather than thinking about that as simply a failure, I think we need to think creatively about how do we capitalize, support, and mobilize community systems to more effectively be a part of the system. Most of our mental health services are very individualized, and from an Indigenous approach, sometimes we need to think more creatively about collective healing, community healing, or healing within the context of a family, for instance. Thinking about other promising practices is that we also heard a lot about accommodations and how supportive accommodations were to young people to access things like school or work, and that accommodations allow them to see that their identity as someone who has a mental health condition or a disability wasn't a fault of their own and could be, in fact, supported and a gift to those environments they interact with. And so thinking about accommodations was really interesting. Again, wasn't a central part of our study, but something we'll think deeply about moving forward. But how do we support success and stability for young people as they're navigating not only the mental health system, but these other systems within their lives? We also asked young people, what would a better system look like? If they were to design a whole new system, what would it entail? And we heard many amazing visions from our young people. But distilled across the data set, this is what we heard. First, that there's a system that is Indigenous led. We heard time and time again that people want Indigenous led services. They want to be in the comfort of community, and they want to ensure that Indigenous led organizations have the capacity, the funding, the training, and the know-how to be able to offer the types of services that they are wanting and needing. They want a system that centers those land-based ceremonial and cultural approaches, again, not as an add-on or an afterthought, but as central to how systems are designed and delivered for Indigenous people. They want a system that has multiple and inclusive options for diverse needs. They recognize that some of the systems they were interacting with were not necessarily designed for them in mind, and that they wanted to see diversity within the system, not simply therapy, not simply assessment or diagnosis or medication, but that we think more creatively about the diverse needs within our community and the diverse approaches to support them. They want a system that is accessible, that is low barrier, and that is free for everyone. They didn't talk specifically about Indigenous youth. They said that this is a basic human right. We need access to free, high quality care, and that this should be available across the board for everyone. They see a system that has competent and culturally safe staff. And this requires us to think about how we train our mental health service providers, both within the Indigenous community and outside of our community, to meet the needs of Indigenous youth, to understand the specificity of our community, the diversity that exists within our community, and that we are investing in workforce development for our own community members to enter into these careers. We also need a system that is consistent and easy to navigate, that we don't have to always keep looking or starting over or getting dropped off and having to follow up. They want a system that really is fundamentally easy to use. They also want a system that integrates mental health with other social determinants of health. As was shared by many of us today, mental health is often contextual. It is contributed to by the other social conditions in someone's life. And so we need a mental health system that isn't simply about responding to mental health crisis, but again, is seeking to ensure that everyone is well before they reach that crisis point. They want a system where youth can lead their own care, where there is agency, autonomy, and choice for them to be able to create their own pathways and have a system that supports them and wraps around them in those choices. And fundamentally, that all of this requires that the system is well resourced, particularly that Indigenous community agencies are resourced well and funded well to be able to support this vision that they are putting forward. And then we're going to move into what's next for this study, and I'll pass it back to Lauren to move us along.
Awesome. Thank you, Nicole. So as we think about where the work goes from here, Felicia will speak to implementation considerations, partnership opportunities, and translating findings into practice and collaboration moving forward. So I'll pass it over to you, Felicia.
Amazing. Thank you, Lauren. Ani, everyone. My name is Felicia Mullen. On my mom's side, I'm Ojibwe and a member of Beausoleil First Nation, which sits on Georgian Bay here in Southern Ontario. And I'm French Canadian on my dad's side. I've recently completed my Bachelor's of Social Work at Toronto Metropolitan University, and I'll be pursuing my Master's of Social Work at the University of Toronto in the Indigenous Trauma and Resiliency field of study. I work at Finding Our Power Together as the project manager for our Bridging the Gaps project. And prior to that, I was working here as the program coordinator. So all to say that my educational and professional journey continue to align with my goals, walking alongside our community members within the mental health sector. I am passionate about the work that we do at Finding Our Power Together and how we can strengthen our community through ceremony and cultural connection. So move into this section, just wanting to spend some more time talking about what it means to move from the findings and into implementation. Because we've done a lot of the groundwork research, and it cannot only just live in a report or in a presentation or in the moment that we're sharing here together. For Bridging the Gaps, the purpose of the research has always been connected to action. The goal is not only to name the gaps, but to support meaningful change in how systems, organizations, and services respond to Indigenous youth mental health. And throughout this project, the findings have helped make visible the barriers Indigenous youth continue to face when seeking mental health support. These barriers do not exist in isolation. They're connected to larger systems of healthcare, education, justice, housing, and community services. And that was very clearly seen when Keelan was sharing the journey mapping. So when we talk about implementation, we're talking more than general program improvement. We're talking about systems change. Systems change means taking what has been shared through this research and using it to shift the conditions around Indigenous youth mental health. It means moving beyond the individual level solutions and looking at the structures, policies, practices, relationships, and service pathways to shape whether young people can access support that feels safe, culturally grounded, and responsive. Implementation is where the findings begin to move outward. It is where research becomes training, practice, stronger partnerships, changes in how organizations understand their role and responsibility. And finally, it becomes a pathway toward more coordinated, culturally safer systems of care. And this is important because it has been mentioned throughout this conversation that Indigenous youth are often expected to navigate these fragmented systems on their own. They're asked to retell their stories, prove their needs, search for culturally relevant support, and move between services that may not be built with their realities in mind. And BTG is helping us name that the burden cannot continue to sit with youth. The responsibility has to shift towards systems. So at this stage of the project, we're moving towards carrying the findings forward in a way that supports real practical systems change. It is about strengthening the bridge between what has been learned through community-based research and what can be changed in practice. And implementation in this context is not a one-size-fits-all model. It's relational, it's responsive, and it's grounded in the knowledge systems that change happens through many points of movement. It happens through organizations potentially changing how they train their staff, service providers changing how they build trust, building those stronger referral pathways, community partnerships, and centering Indigenous voices in decisions that affect their care. So this section is really about the next step of the work, moving from understanding the gaps to actively working to bridge them together. And moving on to the next slide, we'll talk about implementation through partnership. What we're talking about, one of the main ways systems change becomes possible. And partnership is not separate from our research. It's part of how the research moves into action. And the gaps identified through BTG are not held by one organization alone, and they cannot be addressed by one organization alone. Indigenous youth are navigating many systems at once, and the solutions need to be connected across sectors, services, and communities. And that is why partnership is so central to the next phase of this work. As for us, partnership is not simply about collaboration just for the sake of collaboration. It's about building shared capacity to respond differently. It's about supporting organizations to move from awareness into practice, and from practice into that broader systems change. And one of the ways this can happen is through training and knowledge exchanges. So training connected to BTG is not meant to be a checkbox or a one-time learning moment. It is meant to support deeper reflection and practical change. It can help staff teams better understand the realities Indigenous youth are naming, the colonial systems that continue to shape mental health access, and the importance of culturally grounded relational care. But more importantly, training can also support organizations to look at their own role within the system. It can support shifts in how organizations shift into that systems change in their response to crisis, building trust, and creating safer spaces for Indigenous youth. And this is where systems change becomes practical. And it's not only about changing what we believe, it's about changing what we do for how young people experiences the services from the moment they reach out, walk in, are referred, and ask for support. Another piece of implementation through partnership is knowledge exchanges. And there's already deep knowledge within community, within youth serving organizations, and within Indigenous-led spaces. And BTG creates an opportunity to bring research findings into conversation with that existing knowledge, not to replace it, but to strengthen our shared action. Additionally, our partnerships also help reduce that fragmentation. And one of the challenges within youth mental health systems that has been highlighted is that services can be very disconnected from one another. So a young person may be connected to a school, a counselor, a community program, a crisis service, a cultural support, and all of these systems don't always speak to each other in ways that are coordinated or at the safety of the youth experiencing it. So through stronger partnerships, there is an opportunity to build more connected pathways of care. That means improving how organizations understand each other's roles, work towards reducing the burden on youth and families to navigate everything alone. And when we speak about systems change, we're also speaking about sustainability. So a single training can open a door, and sustained partnership allows us to continue the work together. It creates a space for ongoing learning, adaptation, accountability, and relationship building. And that is the kind of implementation that us on our project are interested in supporting. The implementation that is relational, community focused, and supports organizations to make practical shifts and contribute to the broader systems change for Indigenous youth accessing mental health systems. So as this project moves forward, partnerships, training exchanges, these are just some of the ways that our findings can continue to live beyond the research itself and into the practicality. And they allow the work to move into organizations, into staff teams, into service pathways, and into the everyday practices that shape whether Indigenous youth feel supported, safe, and connected. So moving on to the next slide. Before moving into our Q&A part of our agenda today, I want to close the section here with an invitation to collaborate. So this invitation is for organizations, service providers, schools, youth serving organizations, community partners, system leaders who see their work reflected in our findings of Bridging the Gaps. The invitation is a part of carrying this research forward into action because systems change does not happen through research alone. It happens when research is taken up by the people, organizations, and communities who are positioned to shift practice, influence pathways, and build more responsive systems of care. BTG is an opportunity to support that movement. Through partnership, we can explore training opportunities, knowledge exchanges, staff learning sessions, community conversations, and other forms of collaborations help translate the findings into meaningful practice. These opportunities can support organizations in strengthening their understanding of Indigenous youth mental health, colonial and systemic barriers, culturally grounded care, relational approaches, and the practical steps needed to create safer and more responsive services. And this work is not about placing responsibility on one team, one role, or one program. The systems change requires shared responsibility. It requires organizations to look at their policies, practices, assumptions, and relationships. It requires service systems to become more coordinated, accountable, and responsive to what Indigenous youth and communities have already been naming. This is also an invitation to move beyond good intentions. Many organizations want to support Indigenous youth well, and while that intention matters, intention alone does not change systems. Systems change requires action, training, reflection, relationship building, and accountability, and a willingness to shift how services are designed, delivered, and experienced. And BTG is one pathway to support that shift. Not as a finished answer, not as a one-time intervention, but as an ongoing project that can continue to bring research, community knowledge, and practice together. For organizations interested in partnership, this could begin through a training exchange, a knowledge sharing conversation, a collaborative learning opportunity, or a deeper conversation about how our BTG findings connect to your work. The starting point can be simple, but the intention is broader: to contribute to systems that better support Indigenous youth mental health, well-being, culture, identity, and belonging. And as we continue this work forward, we hope to see the systems change Indigenous youth are naming and envisioning in the places where youth are seeking care, connection, and support. So thank you for being part of this conversation today and for considering where your organization, team, or community may connect to the next phase of this work. And we welcome opportunities to build relationships, explore partnership, and continue moving these findings toward meaningful systems change.
Thank you, Felicia. So now we'd like to open the space for discussion and any questions. So please use the Q&A feature to ask the panelists any questions or share reflections that you may have. I can also start us off with a question to get the ball rolling. This is for all the panelists. I was wondering if you could speak a little bit about what drew you to your particular analytical lens and why it felt meaningful to explore that within your work. I'm just going to start with Rochelle.
Thanks, Lauren. I think for me, it was very important for me to not only take the relational aspect to it, but also have that intersectionality of power and that institutional power that obviously is held over a lot of the youth mental health or youth when they're in mental health crises. So for me, I think it was just really important to have that emerge and so that the work can kind of shift away from that systems response. When only Indigenous youth reach crisis, then they get that kind of support. And so it was really important for me to kind of prioritize that ongoing, like relational and culturally grounded community-led support while still showing the side of what happens once they're in every institution that they go to and allowing them to do it through their voice. Thank you.
Thank you so much for sharing. I'll pass it to Keelan for the same question.
Sure. The reason why the story mapping was decided on is because it's important to not frame Indigenous youth as like hard to work with, or like avoidant of the system. It really shows that youth are trying to get support, but are being pushed around these different systems that are really confusing and are fragmented and difficult to navigate. So it takes away from like the individual focus and then brings it back so you can understand instead of saying like, well, what's wrong with these youth? Like they're not finding care. It's like what is wrong with how the system is organized that makes that possible. So that I think was really an important thing that came out when doing those story maps and then seeing like, wow, this person has tried so hard to get care and it hasn't happened. So yeah, thank you.
Awesome. Thank you, Keelan. I'll pass it over to Josh.
Yeah, I think what interested me most about this analytical approach was bringing more visibility to multicultural, bi biracial, multiracial, Indigenous children and youth, and how that identity formation occurs, especially within colonial systems. And yeah, I think it's just been really important to continue that visibility and establish more concrete relational connections between Black and Indigenous communities on this land, and to interrupt what the colonial systems have tried to bring in between these communities.
Thank you. I have a question for Keelan. You know, touched on this a little bit, but I'm just curious like about how the journey mapping felt like an important methodological approach for understanding youth experiences.
That's a good question. Thank you. I think that it was important, like kind of like I mentioned, because it shows like the maze that youth have to work through rather than just knowing that, yes, this took a lot of work. It's like seeing it visually. And when you show other people, you can clearly see that it's complicated and it's a complex weaving through the system that if you imagine yourself doing the same thing, you'd be at least if I look at it, I'm like, wow, this is definitely a lot of work and a lot of knowledge comes with this. So I think that was one of the important parts about really like showing how hard these youth have worked and then where the system has fallen off, where the gaps are, and how they could have been better supported throughout their big life events, throughout wait lists, throughout all of these referrals, and how their journey could have been safer for them from the beginning. So I think that's what I was reflecting on when I was looking at it. But then again, it also just helps show the gaps in institutions and in services and pathways that we need to consider. So thanks.
Awesome, thank you. I have a question for Rochelle. You spoke a lot about like life promotion and the fragmentation, and I'm curious if kind of what broader reflections emerged about how systems respond to youth in moments of crisis.
Yeah, for sure. I think when Indigenous youth are already in crisis, they're already in a space where they're going into something that's completely different. You can't really access personally a lot of well-being and support when you're already in crisis. So they're going into a space and then they're getting re-traumatized and things kind of heighten for them. And so where my kind of bigger thought was the life promotion, so basic human needs, having mental health support along the journey. So they may be checking in every 2 weeks, kind of having like that baseline. So then when they're going, if they need to go into the system, they already have, I guess we can call it their cups full enough that they can actually access the supports that they need once they're in the system, and not just kind of being thrown into it because they have nowhere else to go. And then everything being thrown on top of them isn't really doing what it needs to do. So therefore, it just kind of escalates and it gets harder and harder for them. And then we see a lot too, after 2 days a week, they get pushed out. And then where are they from there? Because they don't have that life promotion. They don't have anybody to help them along the way. Some of them don't have their basic human needs met. So I think that's where kind of like my thought process came from.
Thank you. I have a question for Joshua. How do you resist a Pan-African or Pan-Indigenous construction of knowledge in your findings?
Yes, I think the literature review is reflecting that identity formation for Afro-Indigenous youth is a fluid experience and mapped by experience and contextual histories. So I think there's a part that I'm leaning towards within my literature review that is depicting this fluid relationship, but also I'm anchoring myself as an East African researcher as well with Pari tribal histories, and I will be disclosing throughout the research process as well that the findings are they're not able to speak to the breadth of Afro-Indigenous identities, and I think situating the research in a more living context and that it's continuing to grow is very important to not put another cap on Afro-Indigenous identities.
A slight follow-up to that. What considerations should organizations keep in mind when thinking about intersectional experiences within systems?
Oh, that's a really great question. I think organizations should have an ear to the ground in a sense. They should be doing a lot of work to make connections to other organizations, to be known in the community, as well as I think to be inviting to participants to not only share their identity, but be the ones to construct a lot of how would I say the requests for support rather than it being mandated by organizations. If that makes sense.
I just wanted to remind the participants, if you guys do have questions, there's a Q&A button at the bottom and you can ask anything you want. Okay, so I have a question for Felicia. What would it look like for organizations to move from awareness of these issues into actual practice change?
Thank you, Lauren, for the question. And one thing that comes to mind, particularly of the work that we've been doing so far in the project, is training exchanges, and just those initial conversations with organizations is important. So I talked kind of around like having good intentions around organizations, and while that's important, what are we actually doing with those intentions is putting them into action and into community building, relationship building, our overall relationship capacity with one another in the GTA. So, reaching out to us, having that initial conversation, and then seeing how we can move into some sort of training exchange and learn from one another.
Thank you. I have a question for the presenters, as in Joshua, Keelan, and Rochelle. Back to your analytical lenses, what did this analysis help make visible that may have otherwise been missed? Start with Rochelle.
That's a good question. I think in terms of how I was analyzing the youth responses, having the relational context intersected with the systemic context, it really brought out that need for those basically like those basic human needs and those systemic inequalities to really be looked at and some other way, like really dealt with in the system. And it, from what I was reading, once that, if we can do that, then I think like the distress and the mental health, we will see a decline in it because really not having those pieces and then going into the system is really what emerged like a lot of the suicidality and the distress.
Awesome. Thanks. I'll pass it over to Keelan.
Sure. I think without the institutional ethnography and the story mapping, it would have been easier to see these youth's challenges they brought up as like isolated. Like, oh, this person may just have had one bad provider or one bad experience, or one person who wasn't understanding of the cultural safety. But I think that with this lens, we were able to see that it's not random. When you start comparing all of the story maps and all the patterns, it's clear that it's a system issue and it's not just one person having a hard time. It really helped us see like how eligibility affects how people can access care, how that documentation can be such a barrier, and how disconnected like services might actually be from what youth are actually looking for. And I think that instead of also just doing regular semi-structured interviews, doing story mapping is very, I think, helpful because it shows a visual movement between different institutions and areas, and that the different areas they rely on, so support systems, advocacy. And I think what was interesting was how much self-advocacy and family advocacy had to be done. And I think that that might not have shown up as much if we weren't to map it out the way we did. Thanks.
Thanks. Pass it to you, Josh.
I'll echo Keelan that I think the institutional ethnography research approach was very striking in terms of thinking about the labor of belonging and the labor that is required of Afro-Indigenous youth to go into these institutional spaces and potentially have to hide one part of your identity so much to receive access into the mental health care. And how does that rupture our identities? How does that take us further away on our mental health journeys when potentially being acknowledged at the doorstep is the first step to really addressing some of these issues? And so I really anchor into how is labor being described, and how do those ruling relations dictate how people show up, and how do they construct their narratives in the face of institutions?
Amazing. Thank you. So, Nicole, you mentioned that the project involves analysis and guidance with an Indigenous Community Advisory Committee. Could you say more about the role of the Indigenous Community Advisory Committee in the analysis process, and how did their guidance shape the findings and the way the team is thinking about next steps?
Yeah, thanks, Lauren. Our project has been guided by communities since the very beginning. Like I said, we have our collaborative, which are the three organizations that are partnered on the project, but we wanted to ensure that community was fundamentally guiding the project from the very beginning. And so our first activity of the entire project before we did the research and any of the groundwork data collection was to pull together a community advisory committee, which was comprised of 6 Indigenous community members who represent different walks of life, including youth, Afro-Indigenous youth, folks who work within the system, and community members who have experience or interest in the mental health system. And we meet quarterly to discuss the project, but they were really integral in terms of helping us to think about the right approach, the right questions to ask youth, who should be involved, and also what does it all mean in terms of systems change. And so all of the activities that Felicia talked about have been influenced by the discussion with our ICAC, which is the acronym for the Indigenous Community Advisory Committee. We additionally took our findings to them and actually did collaborative analysis, right? So thinking about these are what the stories that Indigenous youth are sharing with us. What does this actually mean in terms of systems change? They were very integral to helping to shape our understanding of what this meant and where we need to go moving forward. And so it's been a real blessing to have this community advisory committee who really fundamentally care about Indigenous youth, about building better systems, and are providing their insight, their experiences, and their ideas with us to help shape this work in a good way.
Awesome, thank you. I have another question for you, Nicole. What does institutional ethnography allow us to see that might be missed in more traditional mental health research?
Yeah, I think everybody kind of spoke to it,
Mhm.
Josh's insights particularly, but I think, yeah, like was shared in most research, when you're studying an issue, you're studying it from the words that people are saying or the stories that they're sharing. And what institutional ethnography does is that it takes the unit of study away from an individual's experience and applies the lens to the system. And so we still center the voice and experience of those who are most impacted by systemic actors or systems, systemic systems. But instead of situating the problem as emerging within individual stories, we start to look at that system. And it allows for us to, again, see that the system is fundamentally informed by its own ruling relations, its own ideologies, its own values, its own structures, it seeks to replicate itself in the way that it produces and functions. And oftentimes, we don't see that in the human to human interactions that we are having day to day. The day-to-day experiences that we are having are fundamentally impacted by those institutions, by the policies, by the settler colonial context, even more broadly, the time we're in at this moment. And so I think institutional ethnography helps us to consider all of those kind of underlying pieces to the puzzle that we often just take for granted when we're looking only at an individual story.
Thank you. So, kind of as we wrap up here, I have one last question for all the presenters today. And maybe we'll start with Felicia. So, a major question underneath this work is not only whether services exist, but whether care becomes relationally safe enough for youth to stay connected. What did is your analysis or your work reveal about the difference between access to a service and access to meaningful self-care?
Yes, thank you. So to get us started, and I think a little bit more of my background working as the program coordinator at FOPT too has allowed me to also see like what that relational care actually looks like in practice with youth. And it's just building that connection with folks when you first meet them. And it's building that and building that safety of like, we're here, and consistent people also is showing up in this research as well, knowing that that same face will still be there when you come back, and kind of being able to navigate those different systems, but knowing that there's an organization there for you to come back to that understands you. So connection.
I'll pass it over to Rochelle.
I think along a little bit along the lines of what Felicia says, I think it's really important that that connection piece is there. So a lot of the time when I was reading through the youth responses, it was they didn't have that connection, they didn't have that stability, there wasn't that protection, and there was that need for that security and just those needs being met. And so I think it includes like having those things within that system. And I think that's really the piece that stood out with that, especially with the self-care piece, because if they don't have those basic needs, they can't maintain their wellness, they can't maintain their regulation, and then the coping just they don't have that coping mechanism. So then therefore they go within like the different institutions that they need to. And if those things aren't also within there, it just kind of keeps exacerbating.
I'll pass it over to Keelan.
I think that a big gap that I saw was continuity. So yes, like you may be able to access the hospital, a crisis service, a therapist, but when you're there, do you have the chance to actually establish trust and establish a connection with the practitioner you're seeing before you're moved to someone else or before you get an email that says, "Oh, you're being switched over." I think that was a big thing that people talked about. I also agree with what everyone just said. I think that it's so important to have someone like in your circle who asks about you, who really knows you and like what works for you and is willing to try different approaches that like trial and error. But if you don't have a trusted person or someone that knows you well and has been through that with you, I think it would be very hard to maintain that self-care piece. So I think we saw a lot of that in the story maps as well. So yeah, I think that's my point. Thanks.
I'll pass it over to Josh.
Yeah, I would echo what everybody's saying. Like, relationship is the key to our work here, and I would say in those initial like relationship building stages, how big are our ears for the folks that we listen or that we're working with, and how much of those stories are we mulling over versus really sitting with care and acknowledging the multiplicity of realities that exist within a person. And I think being able to slow down, which in and of itself is a systemic issue, but slowing down is really at the heart of meeting folks where they're at and giving the time and space in our days to walk with them into a new space of life and taking those mental health challenges on in a strong and um, healthy manner. But yeah, still acknowledging that the people we work with are the sole constructors of their identity, and how they want to share that with us is the baseline.
I'm also interested in hearing your perspective, Nikki.
Thanks. I mean, I think I agree with everything that's been said, and I think what it fundamentally requires is us to actually think more broadly about mental health and well-being, that we create MAD positive and disability positive organizations, communities, and societies whereby intervention is not the sole part of the puzzle. Like community is central to anyone's well-being. And when we're talking about a community that has high needs, high risk, and fundamentally needs healing on multiple levels, that we need to start to think about how do we meet youth where they're at, wherever they're at, not only in a clinical office, not only in an organization, but everywhere that we see them within community. How do we start to bring back that village where we actually fundamentally care about one another and are looking out for youth? And so that might be a more radical kind of conceptualization. Like we do need to change systems and we do need programs to be safer and better equipped to support our youth. We do need these interventions for sure. And at the same time, I think we need schools that better account for mental health, well-being, and safety and culture, workplaces, societies, and community gatherings that are fundamentally less ableist, fundamentally seeking to support everyone's well-being. And I think we all need to be a part of that work.
Awesome. Thank you. I'm going to pass it over to Felicia to wrap up this lunch and learn. Thank you.
Thank you, Lauren. So, as we close, we invite you to stay connected with Finding Our Power Together and the Bridging the Gaps project. This work is ongoing, and we're always open to conversations around partnership, training exchanges, and just building relationships across community. So, please feel welcome to reach out, follow us on social media, and continue following along as the project and our organization grows. And thank you again for being here, for listening, and for being part of this conversation. You'll find on the screen here a QR code. So we'd love to hear your feedback on today's presentation and what you took away.
Okay, awesome. Thank you everyone for coming. Bye-bye.
Thank you.
Thank you.